Welcome, ladies and gentlemen, to this session, L&R Activa session on debridement, and asking the question, whose problem is it? Well, I'm delighted to welcome you to this today, and I was, just by way of introduction, thinking on my journey on the train on the way up from the West Country here in England up into London, having a very nice sunny train journey on the way up. I was reading through a very large reading pile that I brought with me, but casually looking out of the window at the same time, and just reflecting on the journey of the last 30 or so years of wound care in the UK. And a couple of things struck me. When I think back to when I started as a nurse, we did a couple of things routinely. We routinely used antiseptics, and we routinely used those antiseptics with gauze and wiped the surface of wounds until they were all free of loose tissue and free of exudate before we redressed. Well, of course, the evidence back then was telling us that antiseptics were cytotoxic. And so we stopped doing that for a bit because we thought that that was going to be damaging good cells. And we also stopped doing the wiping because we thought that that would harm good cells. And we justified that because it hurt the patients, and because, as a nurse, we were the ones doing this, certainly in the UK, again and again, treating these patients, hurting them as we were doing that care. It was a very easy justification to move away from the use of those two techniques and completely lose them from the care routine. But with new evidence, as the years have gone by, we've reintroduced and reaccepted antiseptics in their safer formulations, and we've found a better place for those use of those antiseptics and those new formulations with specific wound indications. However, whilst the evidence is now here for debridement, and it's growing all the time, we've not really brought it back because I think routinely we still fear that we're going to do harm by touching the surface of the wound. And that worry of hurting our patients is a very, very important driver for us probably not engaging with debridement in the way that perhaps we should. But with safer technology that's coming through now, maybe that's set to change. So then, to come scything through the long grass in this field of debridement, with me, I have a couple of excellent guests. I have Professor Schultz from Florida, who's going to be talking with us about the science underpinning debridement. And then we have Trudy Young from the Welsh Wound Innovation Centre, who's then going to be talking about the patient experience around wound care, around wound debridement. And I'm going to be talking from the commissioning perspective about how we buy debridement into our wound care system. So, without further ado, I'm going to welcome Greg Schultz to the stage. Thank you.